It's time for the Kim Hammer Show, where you'll learn how your state government affects you, your family, and community. Here's Kim Hammer.
Good afternoon. Welcome to the Kim Hammer Show. You just finished listening up to Dave. He's down at the State Republican Convention down in Benton. They've wrapped up at the Benton Event Center, and you got to hear that from Dave, and we're glad to have you joining us on the Kim Hammer Show today. I want to thank my sponsors because we're going to get right into the show with Dr. Dillaha from the Department of Health. We're going to be talking about contact tracing. If you want to let your friends know, they can tune in order to get straight information. That we'll be starting that in just a second. But I want to thank Everett Buick GMC down in Saline County. Great place for you to go to get your Buick or GMC product down there. They'll take good care of you as far as getting you a new vehicle, or you can get a good certified pre-owned vehicle that has been sent through all the warranty tests, so you'll know you'll be buying a good quality certified pre-owned vehicle. Also, their service department is second to none. You can go down there and get in and out in very quick service. They can take care of you for all your needs, whether it's tires, oil changes, all the things. You got a computer code showing up on your car, all that stuff. They can take care of you, and they'll take care of you in good fashion at affordable prices, and it'll be done by certified mechanics, so you know that it's being done right. Also, want to thank Baxley, Penfield Mounty Real Estate in Central Arkansas. As I always tell you, they can take care of your real estate needs, whether you're buying or selling on the commercial or residential level, or if you're looking to rent either residential or commercial property, or you have property that you would like to rent on the commercial or residential side. You can call my friend Tom Baxley down there at Baxley, Penfield Mounty, and they will get you taken care of, located in Saline County there at Spring Hill and Highway 5. And then, as always, Edwards Food Store. I was in there this morning early. Got my wife breakfast, I want you to know. Got her some sausage gravy, biscuits, scrambled egg, and bacon. And I didn't even have to cook it, just bought it. In fact, I got it cheaper than I could have fixed it if I got it home with it. So, I mean, scored points on both sides there. Stores are always clean. Meat market was well stocked. Everything is clean and in order, and they are helping make sure the store stays safe during this COVID-19 by keeping the store extremely clean with distancing and all the other things that we're trying to do to get through this COVID-19. So those are my sponsors for the show, and I appreciate them helping invest in making sure that you get good quality information, which leads me up to today's topic, which is going to be contact tracing that's carried out by the Department of Health. And I have Dr. Jennifer Dillaha, who is on the line with us. And Dr. Dillaha, thank you for taking time out. I know you're at work, and I appreciate you. You're working on Saturday, and I know you're putting in a lot of hours and a lot of time, so I appreciate you taking a little time to be on the Kim Hammer Show this afternoon.
Well, I'm glad to be with you today.
So let's start off with just explaining what is contact tracing. Just kind of give us the overview of what it is and and then we'll go on into some questions after that.
Sure. So contact tracing is something that we do in public health to break the chain of transmission for an infectious disease. So in this case, when the health department gets notified, usually by a lab report, of a positive case, someone who's tested positive for COVID-19, we have one of our case investigators give them a call. They interview them. They determine when their symptoms started, and then we back up a couple of days. If they don't have symptoms, then we take the date of their test, and we back up a couple of days, and we define that as their period of being infectious. Then we work with that person to learn about where they live, who's in their household that might have been exposed to them while they were infectious, and other things about them, like where have they been during that period of time? Have they been going to work? Have they gone to social events? Have they traveled? And so forth. And then we ask them to make a list of those people that during that period of time and in those situations that they would have been around for 15 minutes or more and within 6 feet. So that's what we define as a close contact. We ask them to make a list, and then a contact tracer will contact them, get that list and the information that they have so that the contact tracer can then take that list and contact all of the people who have been exposed to this person while they were infectious. They give the contacts information about how to quarantine properly, what they need to do, and then also how to stay in touch with us. And one of the options that people have when they're in quarantine is to enroll in the Sarah Alert system. It's an automated system. They can either get a robocall or a text message or an email, and they'll be prompted each day to let us know how they're doing. If they develop symptoms, then they would need to be tested. Oftentimes we test people even if they don't have symptoms in case they would be a case and not have symptoms. And then those people would need to quarantine for 14 days, and if they don't develop the illness, then they're free to go about their business as they would have, before the quarantine period. So the contact tracers are the ones that help us find these contacts, contact them, let them know what to do, and stay in touch with them in case that they develop symptoms and need then also to be accounted as a case of COVID-19.
How many contact tracers do you have now working for the department?
Well, we have been in a period of transition because now the Arkansas Department of Health has engaged 2 companies to do the contact tracing. So we have had roughly a couple of hundred staff work on contact tracing. Now these 2 companies, one of them is General Dynamics Information Technology. We call them GDIT for short. They went live on July 9th, and they will have up to 350 contact tracers that will be making calls to cases to get their list and following up with the contacts. We have also entered into a contract with AFMC, and they will go live this coming Monday on the 20th to also have 350 contact tracers. And this will be of great assistance to us so that we can be timely in the way of following up so that people will know they need to quarantine, when they need to quarantine, and will be better at being able to break that chain of transmission. So we would have at least 700 when both these contracts are up and running fully.
And I know that testing is, the goal I think was 120,000. I can't remember, was it a month or a week that y'all's goal was to do 100?
A month.
A month.
Yes.
So you've got 700 tracers. That doesn't count those that are working for the health department. Is that correct?
Yes. So some of our contact tracers, because we're going to have more of these contracts, can now be involved in helping with the case investigations, the initial contacts to the positive cases. And that's going to help us a lot because, right now, nationally, there's been a lot of demand on the companies, the labs that are running tests, and they're behind. And some of them can't do tests right now because they're out of the reagents or the chemicals that they need to run the tests. So it's put us behind in following up with cases because the test is delayed in being run and then notified. So we would like to be able to be more timely as well with our own efforts to contact cases. So with the contact tracers now, many of them being handled by the companies that we've contracted with, we can now use those same people to help us with the case investigations.
With the time that it takes to get the test back, how effective is and just public disclaimer for the audience, Dr. Dillaha and I have not had this conversation. So this is an ongoing live conversation that we haven't scripted or rehearsed. So just so you know, with the amount of testing that's being done and with the lack of tracers that we have had so far, it seems like the information would be on a lag time that by the time a person gets the results back and the tracer actually contacts them, that the period that you would want them to be quarantined would have already passed. Is that a issue? Is that a challenge? And if it is, how far out in advance do you think throwing 1,000 tracers at it will get you more real time?
I don't know the exact numbers off the top of my head, but we have received complaints from people not being contacted timely, so we know it's happening. So I have heard that some of the commercial labs, people don't find the results for a week, and that's a problem. And then also the health department, we do testing also, and we need to be more timely with notifying people as well. So if we can, at least when we get the result of a test, notify the positive case within 24 to 48 hours, that's our goal, then we can get those names and contacts much earlier and make sure that people are quarantined for the full 14 days. We want people to be quarantined during the incubation period because they could develop illness at any time and expose people. And so that is 14 days after their last day of exposure to the case. So the sooner we can contact the close contacts to the time that the case is diagnosed, then the better that will be for all of us in being able to break the chain of transmission.
And do you believe that the breaking of the chain of the transmission is going to be in that you're going to be quarantining people to where they're not out spreading it? Is that what's behind contact tracing?
Yes. We know that many people will develop the illness and be able to spread it and not know they have it because they either don't have symptoms or their symptoms are so mild that they don't realize they're sick. And then we also know that when people develop symptoms, they can spread it a couple of days before they actually have symptoms. It's the immune response to the virus that causes the symptoms. So the day or two before they have symptoms, that virus is multiplying in their nose, in their mouth, the back of their throat, and they can spread that virus by talking, because that puts out little particles of water with the virus in it. If they cough or sneeze, and they get droplets that spread the virus. And that's why it's so important for people, wherever they go, to wear a cloth face covering to block that spread. But people don't know that they are ill, and consequently, they go about their business. Of course, we all would, and that's why it's useful to wear a cloth face covering. But if we know someone has been exposed, then it's really great if they can stay home and not go places until that incubation period is over.
Okay, I've got one question I'm going to save for that, but let me ask you, because one of the things that people are paranoid about, and I'll be honest with you, anytime government gets involved in your health care, it doesn't always work out so good. Sometimes it does, but sometimes it doesn't. The information, because I was looking over the form that your contact, I always want to say contract, your contact tracers are asked to fill out on each individual, and it's a pretty long form that they've got to fill out. How long is that information kept? Where is it stored? And at what point did you decide that it's no longer valuable information and it is wiped away from the department's history?
Well, right now we have a database that we put the information in, and we do not allow just anyone to have access to it. You have to have a legitimate reason with the health department to do that. Those data will be kept most likely until the end of the epidemic, and then at some point we will have to make a decision about what we're going to do with it. I have not been part of the discussions about those data, but the health department maintains vital records, death and birth certificates. We maintain other registries, and this is what we do to maintain people's privacy in terms of it's a closed system. It's not open to the public. Anyone that needs records from the health department of any type must meet certain criteria, and then if it's for research purposes, then it has to be reviewed and approved by our science advisory committee. So we have multiple layers and multiple steps that we have in place to, one, protect the integrity of the data, and two, protect the privacy of the people whose information is collected in those data systems.
Is there anything else similar that you do in the way of collecting information that compares to the information you're collecting on COVID-19, especially when it comes to the length of time you keep the information you collected on the person you called?
So the Arkansas Department of Health does investigations of any of the reportable infectious diseases. A reportable infectious disease like measles or hepatitis A or HIV, there's a list of reportable diseases. We get those reports, we review them, we interview the case or the case's families to get that information. We investigate it to see who might have been exposed. In some cases, we can offer treatment to the people who've been exposed or a vaccine. Unfortunately, we don't have that option for either of them with COVID-19, but in some diseases we can. And then we track those people, make sure they do well. And so this is very similar with COVID-19 to what we've done for years and years with infectious diseases. Another one that we often take care of is tuberculosis, for example. So we do this. This is part of our routine, what we do. Of course, we haven't done anything this massive in terms of COVID-19 with all these other infectious diseases, but it's a similar process, and the same safeguards are in place to protect people's data and privacy.
Okay. So somebody gets tested, they get a positive result, and that positive result is sent to the health department. Is that how you know to begin the process of contacting somebody to trace who all they've been in contact with?
Yes. So that result is reported to us, and we take that report and follow up on it.
Okay. And I'm looking at a letter that has your name on it that you send to people whenever it is, and it is a pretty stern letter, for lack of better terms.
Yes.
And I mean, you're asking folks to stay quarantined for 14 days, and the consequences if they don't are what?
Well, if someone needs to be quarantined and they don't, then we can step in and issue a legal order of quarantine. We have not had to do that very much during the COVID-19 epidemic. Most people are willing to do what they need to do to keep from spreading the disease, but we can issue a legal order of quarantine, and we want people to take it seriously. This is a serious epidemic or pandemic, and so it's important for us to make sure people know what they need to do and understand what they need to do, and we will work with them to make that possible. Some people are concerned if they quarantine, how will they get food and other necessities, and we work with them to do that.
How many letters have you sent out? Do you know right off?
I don't know off the top of my head. It would have been to the people who are quarantined, and actually I wouldn't hazard a guess how many that is. It would be some thousands of people.
Okay. With regards to, I mean, I was looking over the qualification, or I was looking over the letter or the questionnaire that the contact tracers when they call, ask questions. And I mean, it is a pretty comprehensive, detailed list, including where have you been, such as church and other social gatherings, nephews. I mean, right on down the line. When you get one back from somebody that has tested positive, then the contact tracers start calling everybody on that list based on that information that they've been given. Is that what you do?
Yes, the people who have been identified as close contacts.
And then what happens?
Those people are given information about how to quarantine, what is involved, and they're provided with a letter as follow-up to the phone conversation. And then we stay in contact with them. We like to be able to follow them electronically through Sarah Alert. That makes it easier, at least for us, and for the person being quarantined also to stay in touch electronically. And we don't have to give them a call every day, but some people do prefer individual contacts, and we try to do that. But that really stretches our staff pretty thin. But we follow up, make sure that they're doing okay. If they develop symptoms, we work out a way for them to get tested. Oftentimes, we encourage them to go ahead and get tested even without symptoms while they're in quarantine in the event that they have already become a case. But either way, if their test is negative, they still need to complete the quarantine period, because that's the period of incubation from their initial exposure to the person who was the case. So then at the end of quarantine period, we'll provide them with a letter. Some people need a letter for their employers to go back to work and verify that they have been off work for legitimate reasons, which would be quarantining. So we can also provide that for them, for their employer, if needed.
Okay. So let's just play a scenario here. I get it. I'm a person that's in contact with a whole bunch of people. And so I've tested positive. I'm going to get a call from a contact tracer. I'm going to answer, I think it's like 11 pages worth of questions, which is going to have a whole lot of people on it. And all those people are going to be sent a letter as well, or contacted by the contact tracer. Those people that they contact, if they go get tested and yet they test negative, they're still expected to stay quarantined for 14 days?
14 days after the last exposure they had to you. So sometimes the actual quarantine is not as long because they didn't know they were exposed and it's already into their quarantine period, so they would have to complete the 14 days.
So if I don't get contacted till 10 days, I've only got 4 days left.
That's correct.
And with the number of contact tracers that you're anticipating having, the idea, how realistic it is, idealistic, is that your real time would get to me sooner, so that it might be that my time is not 10 days, it might be 3 days, because I would have been contacted by a contact tracer earlier than later in what would have been the 14 days that I've been in contact with that person.
Well, I'm not sure I understand that correctly, but say, for example, I had COVID-19 and I saw you during the infectious period. So, but I didn't see you again for another 4 days. Does that make sense? So,
it starts at the last day that I saw
that you were, yes.
Okay.
So then you would count 14 days. But during that 14-day period, if I didn't get tested till later in my infectious period, then got the results, that 14 days is ticking away. So it may be that you don't get contacted till the last 5 days of that 14-day period, but we still want people to quarantine for that period because they could still develop illness.
Okay. I've got to take a break, and then we're going to be joined sometime when we come back by Dr. Spann, who's going to come into the conversation, and you and I have worked this out, your agreement to it. Let me just make this statement. I want you to think about it, because this is where we'll pick back up after the break, and that is, we're asking people who have tested negative to go ahead and stay home. We theoretically, if the right people get this and they've got a broad enough network and it continues to trace, we theoretically could shut this whole thing down again just by the fact that people have been in contact with others, even though they go and get tested and they come back negative. And I'm wrestling with the idea of why are we going to shut them down for the remainder of that 14-day period, because that could have some severe consequences with regards to people being able to get to work and just be able to live life and go on normal. Think about that. We'll come back after the break. This is Kim Hammer. You're listening to the Kim Hammer Show with Dr. Dillaha from the Department of Health. We'll be joined by Dr. Eric Spann, a practicing practitioner, when we come back after the break.
This is good news, maybe exactly when you need it to. Right now, MediShare is waiving their new member fees. This could save you money on top of all that you'll save each month by becoming a member of MediShare. So many people are looking for a healthcare solution right now, seeing the cost of COBRA plans, for instance, and MediShare is the affordable alternative to health insurance. The typical family saves $500 a month, but you might save even more. MediShare is a Christian community that shares each other's healthcare costs, and because of the current economic situation, they're making it easier than ever. Apply by July 31st, and you'll save an additional $170 on your first month. I'll give you the number here in a second, and if you call, you can get a price within 2 minutes. Just tell them the promo code SHARE to receive your additional savings. Maybe now is the time to make the switch, like more than 400,000 people already have, and start saving. Here it is, called 844-57-BIBLE. That's 844-57-BIBLE, 844-57-BIBLE.
The people in this movie share three things in common. They're courageous, they've had a life-changing experience, and they're Black American conservatives. These are the voices of the movie, Uncle Tom.
I don't remember the actual day, but I remember the emotion that I felt when it happened.
I'm often asked, was there an epiphany? I started asking questions.
As I became more politically aware,
a lot of the way that I saw things began to change.
All this information I've been taking in for several years.
A continuation of these kind of contradictions.
I had bought into all of these lies.
You begin to see what the real agenda is.
This is the movie the leftist Democrats do not want you to see. These are the people they do not want you to hear. Their stories will shock you. Their journey will amaze you. Their courage will challenge you. Go to UncleTom.com. Buy it now on pay-per-view. UncleTom.com. Do you have the courage to discover the truth?
This is good news, maybe exactly when you need it to. Right now, MediShare is waiving their new member fees. This could save you money on top of all that you'll save each month by becoming a member of MediShare. So many people are looking for a healthcare solution right now, seeing the cost of COBRA plans, for instance, and MediShare is the affordable alternative to health insurance. The typical family saves $500 a month, but you might save even more. MediShare is a Christian community that shares each other's healthcare costs, and because of the current economic situation, they're making it easier than ever. Apply by July 31st, and you'll save an additional $170 on your first month. I'll give you the number here in a second, and if you call, you can get a price within 2 minutes. Just tell them the promo code SHARE to receive your additional savings. Maybe now is the time to make the switch, like more than 400,000 people already have, and start saving. Here it is, called 844-57-BIBLE. That's 844-57-BIBLE, 844-57-BIBLE.
Good afternoon. Welcome back to the Kim Hammer Show. This is Kim Hammer, the host. Thank you for joining me this afternoon. A quick shout out to my sponsors, which would be Everett Buick GMC down in Saline County for a good new vehicle or for a certified pre-owned vehicle that has been checked out, ready to go. You can drive off the lot with confidence. A great place to go, as well as all their service department. And then Baxley, Penfield, Mountie Real Estate here in Central Arkansas. Take care of all your real estate needs. And when I say all your real estate needs, I mean all your real estate needs, whether you're residential or commercial. They'll take really good care of you. They've got great customer service. Also, Edward Food Stores here in Central Arkansas, also over in East Arkansas. Stores are always great, clean. They do a great job as far as dealing with, social distancing and all the things that we're trying to be team players about as we deal with the COVID-19 epidemic. They're well-stocked, and their prices are very competitive, so I'd encourage you to shop Edwards Food Store. All right, next week I want to mention, too, because it is a show I don't think you're going to want to miss. Next week I'm going to have Minnesota Senator Dr. Jensen. He's been in the news a little bit. He has taken an opposite position other than some of those in the medical field, which has resulted in him getting called before the Minnesota Medical Board for his comments that he has made. He has agreed to be on the show, and we'll have him on next Saturday. I'll dedicate the whole show to him, and so make plans now to share that with your friends, and I think it'll be an interesting show to come back on. So, Dr. Dillaha, let me pick up where we left off, and then we're going to bring Dr. Spann into the conversation. How realistic is it that for as much information you have to collect on people, that you're going to be able to go that deep and expect people to stay home, even though the letter that you send to them is a pretty sternly written letter? How realistic is it that it's going to happen, or are we just spending a whole lot of energy for nothing?
Well, my hope is that the vast majority of people will do that, because that's going to be a really important strategy for us in Arkansas to break the chain of transmission. We have got to isolate when we have the illness, and when we've been exposed, we really need to quarantine.
Okay. I did want to ask you a question about the tracers. Are these all employed by the Department of Health and by the two contractors, or do you have volunteers that are doing it?
We have some organizations that have staff that are helping us. It includes Blue Cross Blue Shield, the Central Arkansas Library System, UALR School of Social Work. So they have people in their system that are part of their employees that have been trained as contact tracers, and they are assisting us.
And do they operate under the same HIPAA guidelines that the companies operate under and that the Department of Health? And do you have any known problems with people when they call and they go through this questionnaire being biased in the way in which they ask the information or collect the information?
They are required to have the same kind of training and agreements with HIPAA, as well as the data collection and protection. We wouldn't allow them to do it if we couldn't protect the data and the confidentiality of the information. I have not heard of any problems of groups or individuals not following the, I guess you could say, the script, the information collecting process that we want them to follow. We do have quality control measures into place, and so, if we were to hear of any, we would definitely look into it.
And with regard to a comment you made a while ago about how long the information is stored, you said until the pandemic's over. What constitutes the pandemic being over? Because we're asking people to give a whole lot of personal information on the hopes that someday that information is going to be destroyed or done away with. And that's asking a whole lot of people. And are you having trouble with people actually participating when you call them to get the information on the form?
So what I intended to communicate is that when the pandemic is over, we'll have to decide what to do with the information. I do not know at this point in time what the decision will be, but we do know that we maintain records of other reportable diseases so that they can be traced in the way that they are needed. So it's going to be important for people to provide us with information so that we can track their contacts. We do encounter people who do not want to share their information. They don't want us to know where they have been, and that is a challenge to win the trust of the people we're interviewing so that they can help us stop the spread. Some people are suspicious, and we want people that receive calls from the contact tracers or the health department to know who we are. So we have a call line that they can call if they need to verify, is this really from the health department or on behalf of the health department, and we want people to know if they are ever asked for a Social Security number or for financial information, it is not the health department calling. That is a scam, and we want them not to give Social Security numbers or financial information because that is something that our contact tracers would never ask for.
What is that? Do you have a number that you can give me that I could get up on my website that people could look?
Yes. I don't have it memorized, but hold on and I'll get it for you.
Okay. I'll tell you what, let's bring Dr. Spann into the conversation. Dr. Spann, good to have you on the Kim Hammer Show this afternoon. Thank you for taking time to come back on. There was a few things I wanted to visit with you. We ran out of time last week.
Yeah. Hey, Kim, how you doing? Dr. Dillaha, good to hear from you again. Good to talk to you.
Well, thank you for being here with me.
While you find that number, Dr. Dillaha, let me just go ahead and tee up the next question because
I have the number.
Okay, go ahead.
Okay, it's 1-800-803-7849.
Go ahead again. 800-803-7849.
7849.
Okay.
I'm sorry. 7847.
7847. Okay.
7847.
All right. And I'll get that posted up on the KimHammerShow.com website. So, all right. So let me, we got about 20 minutes. And one of the reasons I wanted to bring Dr. Spann into the conversation, one, we didn't get to finish last week. And Dr. Dillaha, you represent the health department. Dr. Spann is out in the field working. One of the things that I hear, people saying, because we keep getting these directives passed down from the governor, and I know that the health department is an active participant in giving the governor information that he's making the directives and the orders from. So y'all are, kind of joined at the hip. But one thing that is struggling with people out there, people are struggling with, is we've got to see a pathway forward to where we can live life and we can have the hope of knowing that there's a pathway forward out of this. And Dr. Spann, let me pitch that question to you first, because, we are, whether it's hyped up or whether it's reality or whether it's justified or it's not justified, there's a degree of fear that is gripping people. And I think somewhat unnecessarily, especially if you throw the faith component in there, that we need to be able to function as a society and move on and not be locked down by this thing. So let me ask you, Dr. Spann, first of all, to respond to that.
Well, Kim, I see 20 to 40 people a day, depending on the demand, and I interview people. I have patients in my practice who are anarchists, who are Black Lives Matter supporters, who are people who fly the rebel flag in the back of their truck proudly, community leaders, businessmen, CEOs, pastors. I have a ministry that I help and serve pastors from around the world and with counseling and marital help. So I get to talk to a lot of people, and I've been interested especially in country folks and people who have low level education, especially the patients that are over 65, because they're the ones most at risk. And here's the number one question that I get from all those groups, and that is, Dr. Spann, how do we learn to live with this? So just from the wisest man ever born of a human father, King Solomon said, there is no new thing under the sun. This is not unprecedented. We've had other illnesses before. I've said so many times on YouTube, and I said it to you, the polio epidemic would rival this. I do think that the swine flu might have rivaled this. I do think this is a new virus, and we just don't know. And I think that's one of the battles that I've been so thankful for the ADH and the governor's office and how they've handled this. They're trying not to overshoot and overreach, but there is a tipping point where if you don't distance yourself socially and wear masks and wash your hands and obey what the scripture says, obey every ordinance of man for the Lord's sake, for Christians or believers, you're doing harm. And we're supposed to be people out there considering the other fellow. Because we don't know, because there's number one, fear, there's number two, confusion. Number three, there's things that we've said and I've said that I've had to apologize for because we just don't know. I think the Surgeon General said things early on that he's had to go back and retract. So one of the enemies that we have is confusion and a lack of information. Now, I'll give you the other side of that. I have over 120 articles in my email in basket and 27 articles up on my computer that I have not had time to read this week about coronavirus. But I did read 2 or 3 this morning that bear on your point. One is there is a cardiac disorder called Takotsubu's cardiomyopathy, and it's when someone's heart fails from fear. And that has increased significantly in cardiac hospitals in people who don't have coronavirus. So people are actually having coronary syndromes and cardiac syndromes because they are scared to death because of all the publicity and all of the sensationalism in the news. I've got an article up that concerns the challenge in estimating the total lives lost in COVID compared with the disease itself, from that compared with social isolation, depression, unemployment, and not going back to school. So you see this on all sides, but it is a daily issue with the patients that I have from 18 to 85, and I think people understand that if they're obese, pre-diabetic, diabetic, have lung disease, have heart disease over the age of 65, but especially over 80, they're at greater risk. So it's just a fear from confusion, and we don't have that 18 months of data and meta-analyses, but it's getting better. So we're going to be able to start giving people better information. The way out of this is immunity, and that's going to be through vaccines, which there'll probably be only about 50% from the study I saw this morning because of all the anti-vaccine folks out there, and because of those who are afraid to take the vaccine or think the government's going to put a chip in it or something foolish like that. You know, you're going to have about 50%. So then we have then the other 20% that are going to need, or so 10 to 20. They're going to need to become immune through the illness or recovery or some other means. We're going to have treatments. You know, December, January, I fully expect phase 3 trials to be done on the mRNA 1273 from Moderna, and it looks like a great antiviral vaccine. So that's enough for me. I'd like to hear what Dr. Dillaha thinks about that one.
Dr. Dillaha, any comments?
Well, I'm also encouraged by the Moderna vaccine. And there's other vaccine candidates out there. I'm very heartened by the progress with the safety and efficacy studies. You know, the government is really making these companies toe the line with regard to making sure that the vaccines are safe and effective, just like we would under any other circumstance with vaccines in the past when they were developed. The important difference here, and this is a huge risk that the investors are making, is that usually as a vaccine is being going through its trials, the clinical studies, the vaccine manufacturer does not start manufacturing the vaccine until after the vaccine is approved by the FDA. What they're doing now is they're going ahead and making doses of the vaccine even before the vaccine is approved based on the safety and efficacy studies. This is a huge risk because they will have to throw all of that vaccine out if the vaccine studies show that the vaccine is not safe or does not work. So that is one way that as a country, we're getting vaccine ready, so if the vaccine works, we're ready to go, and people can get it right away. But it's a huge risk to investors because they could lose all of the money that they put into manufacturing the vaccine ahead of time if it has to be thrown out.
Kind of a risky question to answer, but I want to ask you anyway because I've already had people say something to me this week about it, and that is, are people going to be mandated to take the vaccine given the severity of COVID-19? Unlike the flu, that if you choose not to take the flu shot, you get the flu, and granted, you're going to pass it on to other people. But are there discussions in the medical world that this is one of those things that a vaccine, if found for COVID, or when it is found for COVID-19, there are going to be attempts to make it mandatory?
I have not heard any discussions to this point in time about making it mandatory.
Okay. So as far as the pathway forward, let me shift and ask you this question. This is the other one I had for you. So one of the things is, like, next week I'm going to have Dr. Jensen on, and he has an impressive track record as a doctor. I've got a lot of doctor friends, and I talk to some of them. They say, we just need to learn to adapt and move on and quit spending all this money doing all this stuff and find the vaccine and deal with it and move on. And then I've got others that are, cheering the governor because he mandated the mask. And so we as lay people are caught in the middle of you medical folks that are back and forth. And I'm not saying that Dr. Spann, you and Dr. Dillaha are at odds each other. I didn't mean to imply that. But how do we as the lay people know who to believe, and how do we as lay people know which report to take? Because since this has started, it's almost like a pancake flipping back and forth. Do you do this or do you not? And let me start this time, Dr. Dillaha.
Well, I think it's important for people to know the sources of the information that they consume. I encourage people to find a source of information that they feel is reliable and stick with it. I think when people internet surf or they get on social media and just dabble in all sorts of information, it can be very alarming to people because people put information out there and try to grab you with it so you'll be exposed to their ads. They're not really there to inform you or make sure you know what is the best information. So I encourage people to find a good source and stick with it. I like to think that I'm a good source of information and that Dr. Spann is a good source. And we want people to know that we have their best interests at heart. It's hard to convince people of that, of course, if they're very suspicious or if they are worried or have a lot of fear. But, the important part, is to know that we in Arkansas have got to work together to make sure that we have good, reliable information out there so that people do know what to do. And it's a hard task to accomplish because there's a lot of misinformation out there also.
Dr. Spann?
Well, I shared earlier how many articles I have on my desk. I have articles in paper print on my desk, Kim, and Dr. Dillaha gets the same articles. I'm looking forward to getting to know Dr. Chai, who is her data synthesis doc, because I want the best studies. But even within one journal, a great journal, you'll have articles that differ on whether it's spread by aerosols or not, and how many people are going to have immunity for longer, and what is the asymptomatic spread. I mean, I can show you everything from it's only 9% asymptomatic spread from World Health Organization or less to 40% to 60% in some cases. But what she said is true. Let me just say amen, because what she said is right. Even I have to limit my exposure. My concern is people are getting the medical information, as I said to you last week, from breaking news. And you sure don't want to have CNN or MSNBC or even Fox News being the source that you use, because they want eyeballs. They want to sell ads. Everybody on the internet's worse than cable news. But I even have to limit mine to 3 or 4 major sources. But you're going to find different things. The idea is, Scripture says, let everything be confirmed in the mouth of 2 or 3 witnesses. When you find 3 major sources, which I always tell my patients, look, you listen to the Arkansas Department of Health, and you check it with me to see if the common sense answer that I've synthesized is the same. And then you talk to someone who has your best interest at heart that's not medical, like your pastor. If you have 3 people that say the same thing, you got a pretty good answer, especially if it's confirmed by scientists who have a different, basically, worldview than you do. The problem we have out there is there's way too much suspicion and negativity and just rebelliousness in some that just, if the government says it, they just want to throw it out of hand. The Arkansas Department of Health and Governor Hutchinson and Nate Smith and Dr. Romero and Dr. Dillaha and Dr. Chai have one interest at heart, and that is your safety. They may have to go to the extreme because they're policymakers, but they're not going to put out anything. They don't want to ever have to retract anything, and they sure don't want anybody to die. And neither do I, but I'm an individual as well, and I don't make policy. So I would say you get your information from a very trustworthy source, and don't make it Twitter. Certainly don't make it Facebook. Don't make it any social feed where people have no accountability and have to have no discipline. And if they don't have a state license, I wouldn't listen to them. Okay?
All right. Hey, let me...
Dr. Dillaha thinks about that one.
Okay. Let me ask you, I need to ask Dr. Dillaha one question. And Dr. Dillaha, not to put you on the spot, but I've had several preachers reach out to me this past week, directly and indirectly, and they felt from some of their members that churches were being targeted. You throw on that the list that was released, which I don't remember. It may have been out there, and maybe I just missed it, but I don't see a list of the Walmarts where there were, employees identified or other private businesses, but the church list got put out there. And I need to hear on behalf of my constituents and those that are listening, an explanation from the health department of the church list issue, and also just straight up, is the Department of Health or those that are working as contact tracers targeting churches as far as being a contributing source to the problem?
Well, I can tell you that we had identified some churches where transmission had taken place, and they were churches that really weren't following the recommendations. So our goal was to work with those churches to help them understand what the recommendations were and encourage them to follow them to prevent spread. So we did have a list of these churches, and the press learned about that list and requested it, and we felt that we didn't have any choice but to release it because they could have just FOI'd it. There wasn't a way that we could not release the list. And it gave us a lot of angst and heartburn to do it because we were not interested in calling out the churches. And we have people on our staff who take their faith really seriously and had been working with the churches and were very unhappy that it was released. And then we found that the articles were faulting us for releasing the list when we felt we didn't have a choice because it was requested by the media. So it put us in a very difficult situation, and we have been trying hard to regain the trust of the congregations that felt that they were unfairly highlighted. And we do want to work with churches to minimize the spread. We know that COVID-19 has occurred in churches and that church members have died of COVID-19 in Arkansas from catching it in churches. So we don't want that to happen. And we are not targeting churches any more than any other location. Of course, churches don't have the same mandate that, say, restaurants do, but we still want to work with them to make sure that they know the best practices and why things are recommended, and encourage them with the data that we have about churches that hasn't been published. So that's kind of a general synopsis of how things went around here.
Okay, let me give you a quick scenario. Then we've only got a couple minutes, and so at a church, if the people get out of the car and they're wearing masks and they walk through the congregation to their seats and they sit down, then are they under the guidelines? They are able to take the mask off at that time, participate in worship, and understand communion is a different environment. That's kind of a set-aside issue, but just the general worship. And then when they get ready to leave, they put the mask back on and wear the mask back to the car. Is that a safe enough practice for a congregation to utilize?
I would say with what we're learning about the virus being aerosolized, that I would encourage people in churches to wear the mask at all times, except when they're taking communion. We know that especially with singing is just extremely good at aerosolizing the virus. That, I would even discourage churches from singing. Have instrumental music or a singer, but that is separated from the rest of the congregation. But I think wearing masks in church is going to be very important.
I tell you what, I'll get you back on, not next week, because I got Dr. Jensen. We'll have a follow-up on that. One of the things, and I'm about out of time, I'm sorry, got to go, but one of the things is a little bit of conflicting information because we're told if we can maintain 6 feet apart, it's okay. And I think that's something we got to work on, is streamlining the information to be consistent so it doesn't send out mixed messages.
Yeah. Right. Well, and it's not black and white. There's nothing magic about 6 feet,
All right. I got 1 minute. I got to give my sponsors a little credit. Dr. Spann, thanks for coming on. We'll get you back on in the future. Dr. Dillaha, thanks for coming on the Kim Hammer Show. It's Saturday. I appreciate y'all giving up your time. I only get an hour, but I appreciate you doing it. All right, this is Kim Hammer Show. I want to thank the sponsors, which are Everett, Buick GMC down in Saline County, Baxley, Mouty, Penfield Real Estate down in Saline County, but serving all these places serve all of Arkansas. They're just located in Central Arkansas. Edwards Food Store, also in Central Arkansas and over in East Arkansas. go up to my website. I'll get that phone number that Dr. Dillaha gave out a while ago. You probably didn't get everything answered that you wanted to have, but come back. We'll keep giving you information from week to week. And thank you for listening to the Kim Hammer Show here on 101.1 FM, The Answer.
.1 FM, The Answer. KDXE FM, Kamak Village, Little Rock. A Salem Media Group station. 101.1 FM, The Answer.